Hi, Weekly.
No, Jules had already started the podcast already.
You know that
Hi,
I like
guys.
to start it a little bit ahead, so if I have to cut anything, I can do that. But anyway,
okay.
hi guys. Yes, my eye is still red. Don't worry.
I didn't put my drops in today.
Well, it's because of the little.
Oh,
little
yeah.
capillary.
Julie had a random.
If you didn't see it on Instagram, I explained I'm okay. My eye's not falling out of my body.
It's just a little busting.
Yeah, it just popped up. I did go to the ophthalmologist, check. Everything's
did?
fine. Yes, because my mom was like, oh my God. And my mother, she had glaucoma or whatever. I don't know. She thought that my eye pressure was off. Eye pressure's fine. Everything's fine. Apparently, I need to sleep more and be careful with how I'm lifting weights. Cool.
Oh, yeah. I mean, that's definitely something.
Yeah, so that's what she told me. And then if it happens again, then there's something, further investigation needs to happen. Nothing has happened. It's already leaving. So,
yeah. Oh, that's good.
Yeah, so that's what's happening with my eye. It's beautiful, isn't it? Look at that. Anyway, and that's only for you guys that's seeing on YouTube.
No, and it's gotten a lot better.
Oh, yeah.
Last week. Yeah. Last week, I was like, what the hell happened to your eye?
Yeah. Evie was like, Jesus Christ. Just like Mario.
Yeah, I just didn't know. I wasn't expecting it. I was like, oh my God. Have you seen your eyeball?
Yeah. Anyway, so today's episode, we decided to go along with 420. And we're going to talk about
cannabis.
Yeah.
Very hot topic.
Hot.
Yeah. Okay, so this is going to be, we're going to focus on the medical aspect of cannabis.
Right.
Okay, so I know there's a lot of opinions out there. Trust me.
Yeah, we know.
Even coming from a doctor's perspective, like
100%.
we have a lot of opinions too. Okay?
100%, yeah.
But yeah, we're going to stick to the medical aspect of it. Yeah, so comment below. Okay, comment on anywhere on our threads, on our Instagram.
Thank you for friends. Friends on threads. You guys are the freaking. You're amazing.
Yeah,
honestly, like, have you been on threads lately?
Yeah. They're great. I mean, I'm addicted to threads. I don't post a lot because it's just me.
Yeah.
Julie's usually our poster. If you guys haven't noticed, I'm usually like in the background. Okay.
Yeah.
It's our personalities.
If something's more technical, that needs a more technical, more medical experienced answer, she'll take over.
Yeah, but then Jules is really just the social butterfly here.
No, I'm the introvert. I'm more like the social media manager. I manage all of the things.
I'm not sure about that. Y'all can vote. Do you think Julie's a social butterfly? Or do you think she's an introvert? She ain't an introvert to me.
Whatever. Anyway. Cannabis.
Cannabis. Okay. So what is cannabis? Cannabis is also known by various other names such as marijuana, weed, Mary Jane. I can come up with a bunch of stuff. So it's a genus of flowering plants from the family Cannabaceae. Cannabaceae. Yeah. All right, whatever. So I'm not a botanist. The genus is indigenous to and originates from Asia, and its use spans for both recreational and medicinal purposes, as well as for hemp fiber, seeds, and oils. So cannabis sativa, cannabis indica, and cannabis ruderalis, are the species recognized within this genus through their classification and can vary. So the plant is characterized by the psychoactive properties primarily due to the presence of tetrahydrocannabinol, and that is THC, what we know as THC, which is the main psychoactive component. So in layman terms, the one that gives you that high. So that's THC. Cannabis contains over 540 chemical substances, with at least 65 other cannabinoids, like cannabidiol, CBD, contributing to its other effects. So that's the more like...
So glad you're reading this first part.
Yeah. Joel, I would have loved to see Jules read all these words.
Nope.
Okay. So the plant can be consumed in various forms, including smoking, vaping, foods, extracts. Man, there's people making creams out of these things.
Yeah.
Its effects includes euphoria, altered states of mind, difficulty concentrating, impaired short-term memory, increased appetite. However, it can also lead to adverse mental effects such as anxiety, delusion, psychosis, especially at high doses. So physical effects include increased heart rate and difficulty breathing. So I think that kind of comes from that anxious portion of it.
Yeah.
So
I've seen that. Have you seen it?
Yeah.
Oh my God. It's actually really funny. I mean, it sucks for the person experiencing it, but it's funny to look at from the outside.
Oh my God, you're so evil.
I know.
Like, oh, a person's having a bad trip.
pretty fucking funny because I know that they're gonna be fine. It's all just like induced by this and like.
Oh, they're probably living in terror.
Well, no, I'm not saying that level. I'm talking about like people that are just like a little paranoid, like, oh my God, there's a cop coming. It's like, dude,
I just think
You're
of
fine.
Pineapple Express and it's just
yeah,
funny.
exactly. Like that type of funny. I'm not talking about like, oh my God, there's spiders coming out of the vent. No, I'm not talking that. That's horrible. That's horrible. But that's more like LSD. Check out MK Ultra episode.
Yeah.
Wow.
Okay. So cannabis is most widely cultivated, trafficked, and abused illicit drug worldwide, with approximately 147 million people, or 2.5% of the global population, consuming it. Despite its widespread use and some medicinal benefits, such as reducing nausea during chemotherapy, improving appetite in HIV/AIDS patients, and also treating chronic pain and muscle spasms, the legal status of cannabis varies across different jurisdictions. And again, just because it works for someone does not mean it will work for you or for another person. So when we say these things, it's just the general information.
Yeah,
okay?
and it has very different effects on very different people. Like, you know, some people, like we had just said, they'll get paranoid. You know,
Yeah.
there's other people that'll just relax or whatever.
No,
you
not
know.
only that, but I've had patients where they use marijuana for nausea, right? But you can actually have the reverse effects of marijuana. You can have hyperemesis. Okay. So you can actually, it's going to be worse.
Yeah.
So I've had patients come in, like just vomiting their life away and feeling awful. And it's because they need to stop smoking.
Yeah. That's why it affects everybody differently. Just because your friend is experiencing a great high doesn't mean that you will. So just be careful.
Yep. So, all right, Jules, where's it from?
All right. So it could be traced back to ancient times with evidence suggesting its use for medicinal, religious, and recreational purposes. The plant is believed to have originated, like she had earlier said, in Central Asia, but its exact origin and domestication are debated. So early evidence of cannabis use dates back to around 2700 BCE in Central Asia, where it was used for ritualistic and medicinal purposes. The earliest known written record of cannabis usage is from the Greek historian Herodotus.
Herodotus? Yeah.
Okay, who described the Scythians.
Yeah, Scythians, yeah.
Okay, inhaling cannabis smoke around 440 BCE. So cannabis has been around for quite some time.
Yes.
It was also used in ancient China, where it was domesticated as an oil seed crop. In the Middle East, its use spread throughout the Islamic Empire and reached North Africa. Cannabis was introduced in the Western Hemisphere in the 16th century by Spanish explorers, who brought it to Chile for its use as fiber. In the 19th century, cannabis began to be restricted in colonial countries, often associated with racial and class stresses. In the middle of the 20th century, international coordination led to sweeping restrictions on cannabis throughout most of the globe. However, in the 21st century, some nations began to decriminalize or legalize cannabis for its economic and pharmacological benefits. The legal status of cannabis varies across different jurisdictions. For example, California was the first U.S. state to legalize marijuana in 1996, while Colorado was the first state to legalize recreational marijuana in 2014. I remember when that happened, everybody was like... Uruguay was the first country to legalize cannabis in 2014, and later Thailand became the first Asian country to legalize cannabis in 2022.
Yeah. So that's a little bit of history.
Yeah.
All right, so now we're going to talk a little bit about THC, okay, or tetrahydrocannabinol, okay? So it's the main psychoactive compound in cannabis. It is responsible for the high or the intoxicating effects of the plant. So THC is a cannabinoid. Sorry, guys. These words are like really hard to just say, like running on.
Yeah.
So THC is a cannabinoid. It's a type of chemical found in the cannabis plant. When a person smokes, eats, vapes cannabis, then the THC is absorbed into their bloodstream and then carried to the brain. And then where it binds to specific receptors, yes, we do have receptors for this, producing the psychoactive effects. Okay. So THC can have both short-term and long-term effects on the brain. Short-term effects may include altered senses, changes in mood, impaired body movement, difficulty with thinking and problem solving, impaired memories, hallucinations. and delusions, and taken in high doses too. So long-term effects may include impaired thinking, memory, and learning functions, and potential permanent changes of the brain development, especially if you are starting to use cannabis like when you're younger. Okay. So when you're younger, your brain is still developing. So if you have things that is already affecting the brain,
Yeah.
like at its point where it's supposed to be growing and maturing and really starting to like really just like finish its development and its growth, then you're going to stunt that somewhere along the line. Okay. There's also been studies, showing that like frequent use of cannabis can lead to kind of almost just a very like dysthymic type of like mood. So you're just kind of blah the entire time. So it really decreases your motivation in general. So it can be associated with that too. Okay. So in addition to psychoactive effects, THC can be shown to have medicinal benefits such as reducing nausea and increasing appetite in chemotherapy patients. Again, take that with a grain of salt. Okay.
Right.
It does work. I know that it does work for some people, but I don't think it works for everyone.
Right.
However, the long-term effects of THC on the brain are still being studied, and more research is really needed to fully understand its potential benefits and risks. Do you want to talk about CBD?
Alrighty.
Yeah.
So that was the THC factor
Yeah,
of
we're
this
going to talk
plant.
about CBD
Now
now.
CBD is a different one. So it's
Which is the more accepted
Yeah.
form of marijuana.
right. So cannabidiol
Cannabidiol.
or CBD is a non-psychoactive compound found in the cannabis plant. It is one of the two main cannabinoids
Yep.
along with THC, which is responsible for the psychoactive effects of cannabis. CBD is often derived from hemp, and that's a cousin of marijuana or can be manufactured in a laboratory. Unlike THC, CBD does not produce a high or psychoactive effects on its own, hence why it's more like accepted and all that. So CBD has been studied for its potential health benefits, including reducing seizures in some childhood epilepsy syndromes, such as Dravet syndrome and Lennox-Gastaut syndrome, and treating muscle spasticity associated with multiple sclerosis and cancer pain.
So funny story. Not that I want to interrupt, but Julie just said Lennox-Gastaut. So when I was a medical student for the first, I was a third year medical student, and it was my first audition rotation. So basically, as a third year medical student, you have to audition in some places if you want to match there for residency. So it was my first audition rotation, and I had a patient that had Lennox-Gastaut. So Lennox-Gastaut is just like a really bad epilepsy. Okay. So you just have like a lot of seizures all the time. It's very hard to control. It usually fails a lot of medications. So I had to present the patient, and I'm like, she's a 6-year-old female with history of, and I butchered
The name.
Oh, like
that
when
beat
I
me for
say
everything.
butchered,
Beat me for
I
everything.
butchered it to the point where my attending had this face of like disgust. Like, how could you not? I was like, Lennox Gastaut, and she was just no. She literally was just like, no, Yvette, it's Lennox-Gastaut. And then I was like, Lennox. And I was even confused for a second.
Yeah.
Because I was like, what is she talking to me
Yeah,
about?
yeah.
I had no idea that I had butchered the name.
Oh boy.
And even my seniors were so embarrassed of it. And I was just like, why didn't anyone correct me? But yeah, total embarrassing moment for me. Okay,
Well,
so
I'm
yes.
glad that you didn't match there then. Screw that place.
No, I did match there. That's right.
Oh,
But it was at
crap.
USF.
Ah, crap. Jesus.
That's where I went for residency.
So apparently you didn't do that bad.
I still love. No, I know. I just butchered it. I just remember the person, my attending at that time, and I love her to death. But she was just so. I was a third year medical student. I had never seen Lennox-Gastaut before.
Yeah.
Like where I had done peds in my medical school, we didn't really have a standalone children's hospital. So we used to go to like community hospital for
Right.
peds, but we would never see these type of children. you
Yeah,
know?
yeah. With
We
these
would-
type of
with these type of problems.
Yeah,
like
yeah.
all these children would go and get transferred out to like bigger
Right.
children's hospitals.
That makes sense.
So, when I got this patient, I was like, oh my God, there's so many complications here.
Jeez.
But anyways, yeah, well, I guess I didn't do that bad. So,
Like clearly. That's why I was like, oh,
all right. So, okay. Anyways, continue.
Oh god.
Back to CBD.
Back to CBD. All right. So in the US, the FDA has approved a drug called Epidiolex.
Yeah, Epidiolex.
There we go.
I've had a couple patients on them.
Oh, okay. Which contains purified CBD from hemp to treat rare seizure disorders. However, it's important to note that CBD is legal if it comes from hemp, but it's not illegal if it comes from marijuana, even though it's the exact same molecule. Whatever. There are potential harms and side effects associated with CBD use, including liver damage, interference with other drugs, drowsiness, diarrhea, and changes in mood.
Have you ever had hemp?
No.
They usually throw it on acai bowls.
Really?
Yeah. They do like little hemp seeds. You can buy them. It's actually pretty good.
But do you feel anything?
No, nothing.
Nothing, right?
Nothing,
No.
zero. Yeah.
So more research is needed to fully understand the safety and effectiveness of CBD products. Yeah.
All right. So let's talk about some of the medicinal uses of cannabis. So the proven medicinal uses for cannabis include 1, treating symptoms such as pain, muscle stiffness, and bladder issues, like in people that have multiple sclerosis. So there's been a study in 2012 that found that people with MS who took an oral extract of cannabis had almost twice as much relief from muscle stiffness. And we're just, kind of giving you the conclusion of stuff, okay? Reducing seizures in some childhood epilepsy syndromes, such as Dravet syndrome and Lennox-Gastaut. So I have had a couple patients that I took care of in the past that are on Epidiolex. Usually Epidiolex is like the last line of treatment.
Yeah.
So you have to fail multiple
Like other
drugs in
medicines
order to have that. Only certain types of physicians can have access to prescribe Epidiolex.
Makes sense. Okay.
I will say that the patients that I've had on Epidiolex that have failed have like a crazy significant reduction in their seizures.
Oh, that's good.
Yeah. But it is so hard. Like I remember working at the hospitals, like just to have that on your med rec.
Okay.
So when a person is admitted to the hospital, you need to review all their medications, right? And to see what we need to give in the hospital. So we would have to have a pharmacy come in and approve it themselves. It's very monitored. But I will say it does change a lot of people's lives. Yeah.
That's great. Man.
Yeah. So I mean, like they're still like researching it and all of that, but it does work.
That's awesome.
Yeah. All right. So we can also treat muscle spasticity, like we said, of MS, or also cancer pain, alleviating chronic pain, including neuropathy, arthritis, fibromyalgia. You can also have improved sleep quality in people with chronic pain, reducing nausea.
That's something I would have done.
Nausea.
I would have totally done that.
Reducing nausea, vomiting caused by chemotherapy. I can't talk right now. Chemotherapy. Well, I said
It's
it
the
right.
morning.
Chemotherapy.
You said it fine.
I don't know why I said it. It sounded weird.
It's the morning.
Yeah. And then also it's an appetite stimulant for people that have things like HIV, AIDS, and also cancer. Okay. Yeah. So it is important to note that while these benefits have been observed in some studies, what's the bottom line? We need more research. Okay. So it's not to discredit some of the research that's been done. It's just to make aware that there's small studies and we just need bigger and better studies.
More robust, Yvette.
More robust, Julia. More robust. Okay, we need more robust evidence, okay, to truly say, should this be recommended or not?
Yeah.
Okay. And additionally, the legal status availability for cannabis and medicinal use vary by jurisdiction. Again, like it was like impossible as a prescription, okay, for like epilepsy. Like it was really crazy to always have that like approved on the MAR for any kids that were being admitted to the hospital. So yeah, just talk to your doctor, guys, if you feel like this would benefit you, but talk to your doctor about it. Okay?
Definitely. Because again, like we said, it could interfere with other drugs. So talk to your doctor so they can make sure that whatever you're taking is okay. You know, what happened?
I was just thinking about something.
Oh, okay. I thought you saw something outside. I'm like, what is it?
No, I was just thinking because it's, like this is still something that's so...
It's pretty
new. And okay, it's not like new. Like I know that a lot of people have different definitions of new, but it's almost, I want to say like rogue,
Yeah.
So,
or at least people, because
there's a high tie to judgment.
That's it.
And,
Yeah.
you know,
Because marijuana has had this reputation from like the past, like boomers and whatever, like of
Yeah.
it being a drug, it being like people that are lazy to have it. And lately with research and new studies,
Yeah.
we've seen that it doesn't have to be like that, that it could actually be used for good stuff, you know? So
Yeah.
since it has that stigma, that's the freaking word that I was
Yeah.
looking for. If it has that stigma tied to it, it's
Yeah.
hard to put the stigma, you know, away and see what it could be actually used for, you
Yeah.
know?
Yeah.
So it's hard. Anyway, so what are the health risks associated with cannabis? The key short-term effects of cannabis use includes the following. So increased heart rate and risk of a heart attack, increased risk of stroke, problems with coordination impacting safe driving or playing sports. Because again, if you're high, maybe you shouldn't be freaking driving.
So I don't understand why like people always put what?
I don't know, this truck is doing some evasive maneuvers out there.
Oh.
I was just like, you touch my fence, I will come at you. Sorry.
No, I was gonna say that a lot of people post like smoking and them driving at the same time, and I'm like, that is literally like you posting drinking and driving.
Yeah. Like, hello.
Like, do not
That's
care.
literally driving under the influence.
Yeah.
Driving.
And people
Guys,
do it all the time.
Driving under the influence is not only driving under the influence of alcohol, it's under the influence of drugs.
Yeah, and
you
then
know,
I love
that
how,
would
like,
impair
some-
you like that.
Yeah, and then some people are like, oh yeah, I'm a great like driver when I'm high. That's great, but that's like driving drunk.
Can we not?
Yeah.
You know, it's because
You
you're
should not.
You're being selfish. It's not only for you, it's whoever you end
And
up
then
in
you're
an
driving, you're
accident with.
smoking, and then you're also recording yourself. I'm like, what?
Can we just not? I know. It's like the people that I see a lot of times in the mornings, of course, because it's in the morning and everybody's in a rush to get to work because, you know, the US and that's what we do here, that they're eating, they're doing their makeup, they're driving, or they're talking on the phone, and then also like a million things all at once. And I'm like, guys. And mind you, she drives an hour to and from work.
Yeah.
Like she has a crazy commute, guys. Like, you know how you had hashtag pray for Julie?
Yeah,
Hashtag pray for
Evie.
Evie. Like
Please, I need it.
every time she drives to and from work, I'm like, I don't know. Anyway, so back to this. Problems with coordination, like I had said, and you know, playing sports, driving, all those things. Sexual problems for males in specific. So yeah, I mean, you say that and males are like, what?
Yeah.
So yeah, careful. Increased risk of contracting sexually transmitted infections for females. Impaired thinking, memory, and ability to learn and perform complex tasks. Because again, you're like, hi. Severe anxiety, including paranoia. Psychosis, including hallucinations and loss of sense of personal identity. That freaks me out. Panic, lowered reaction time. And yeah, these are just some of them. So research results indicate that these short-term effects can occur within minutes of using cannabis, as the active compounds are quickly absorbed into the bloodstream and reach the brain. The severity and duration of these effects can vary depending on the dose, method of consumption, and individual factors, which is fascinating because I have heard that you feel different. Even if it's the same strain and whatever, you feel different if you eat it versus smoking it.
Oh yeah, I mean the ingestion of it is completely different.
Yeah.
You know.
Yeah. I mean, it's still going to end up in your bloodstream.
Yeah.
But how it affects you differently from those two methods of consumption.
Yeah. I wonder if like dosing has to do with that too.
It has to, yeah. Because there's only so much that you're going to get from actual smoke versus full on eating it.
Full on eating it.
Yeah. You're eating the whole thing at that point.
Yeah.
So,
For sure. All right, let's talk about long-term health associated risks, okay, with cannabis. So addiction and dependence. Listen,
Yeah.
I'm not here to fight with anyone, okay? But it is known as a gateway drug. So what does that mean? It's not that it has this addictive profile, which actually it does have a little bit of a mild addictive profile, which I'm talking about right now. But it can open up the doors to other things, like wanting to try other things.
Right.
Okay.
Right. That makes sense.
So cannabis is used most widely. It's most widely used as a drug. Okay. So most people are not taking it for quote unquote benefits. Okay. Medicinal. Yeah. And its use can lead to addiction and dependence, especially with long-term use of it. Okay. So you can also have respiratory issues. Smoking cannabis can lead to respiratory problems such as bronchitis and may increase the risk of lung infections, especially if you're vaping it, okay? Because when you're vaping it, you have a ton of other stuff. Check out our vaping episode.
I was just going to say that.
And then that can also have detrimental effects to your lungs as well. So cardiovascular effects, cannabis has been associated with an increased risk of cardiovascular events such as arrhythmias, acute coronary syndrome, so heart attacks,
Yeah.
and also stroke, in particularly older adults or those with already underlying heart conditions. So mental health effects. Cannabis use can have negative impacts on mental health, including increased risk of psychosis, anxiety, and depression, especially with the high THC products. Okay. And then, yes, there's other things, like sometimes it has that euphoria, so the giggliness and all that stuff, but it can have all these other things. Okay. And cognitive impairments, cannabis use, particularly during adolescence, can lead to impaired thinking, memory, learning abilities, and that could potentially be long lasting. Okay. So, kind of like what I was saying before, your brain is growing, it's developing, your brain structure changes. So, the smaller hippocampus, the brain region responsible for learning and memory, in the long term can be affected by heavy smoking. Okay. And then also, like, we don't really have measurements for like heavy smoking. Like, what is
Yeah.
heavy smoking?
Yeah.
So, and everyone is different. So, it's just, if you're doing it, you're at risk. Okay?
Exactly.
And then you can also have a decline in your IQ. So, with an average decline of 5.5 points in long term heavy users, according to a 2022 article published on American Journal of Psychiatry. So, again, all these things are just, like cues and insights to the potential use of cannabis. Okay. I'm sure there's a lot of people out there like, let's talk about its benefits. We've only been talking about its activity. Okay.
I mean, we kind of did.
We
it
did.
helps with nausea, with pain, with sleep sometimes,
Yeah.
But again, it all depends on how,
How it's used.
Exactly.
Yeah. And like we said, like a lot of people aren't using it for its medicinal effects. A lot of people are just using it as an illicit drug.
Yeah,
So,
for the high.
yeah. All right. So increased risk of using other drugs. So like I kind of discussed, it is like a little bit of a gateway. So cannabis use has been linked to higher likelihood of using other drugs. Okay. Such as cocaine, heroin, anything
Whatever.
else. Okay.
Yeah.
So poisoning and overdose. So accidental ingestion or overconsumption of cannabis, especially in edible forms, can lead to poisoning and overdose, particularly in kids. Okay. So yes, like there's a lot of people that say it's impossible to overdose on cannabis. No, you can. Okay.
Yeah.
So don't rely on that. Okay. You're
Yeah.
going to feel like shit. Okay.
Horrible.
Yeah. So it's important to note that the health risks can vary depending on the method of consumption and also the amount, that you're taking, your
Yeah.
age, your health, all
So
of
many-
that, and the potency of cannabis products, and also like just individual factors, everything that we have just said. Okay. So consult with your doctor.
Yeah. Yeah.
But I can already tell you that they're probably going to tell you to stop doing that.
Yeah. Exactly. As a doctor.
Yeah, as a doctor. Or at least that's what I tell my patients. Okay. So, Jules, where's
All right.
it legal?
So where is it legal in the US? Because like I said, it's very different even here in the US, but globally, there are some places that it's just totally illegal. So anyway, here in the US, recreational cannabis legalization. As of 2024, so right now, recreational cannabis is legal in 24 US states, 3 territories, and Washington, D.C. The states that have legalized recreational cannabis use include Colorado, Washington, Alaska, Oregon, California, Maine, Massachusetts, Nevada.
Yeah. And remember, this is recreational.
Yeah. Vermont, New York, and some more. But these are like the top ones at least. Medical cannabis legalization. 38 U.S. states, 4 territories, and Washington, D.C. have legalized the medical use of cannabis. Decriminalization, which is different. 27 U.S. states and Washington, D.C. have decriminalized small amounts of cannabis, meaning possession is a civil offense rather than a criminal one. And federal status. At the federal level in the U.S., cannabis remains illegal and classified as Schedule 1 controlled substance. However, there have been efforts to decriminalize it at the federal level as well, which is one of the many reasons why it's interesting, not medical related at all, but like not houses, but the stores that sell like medical grade marijuana, whatever, they can't deposit that money into banks.
Yeah.
Yeah, because banks are federally,
Yeah.
So yeah, that was interesting when I found that out. I'm like, oh shit. Anyway, so in summary, the legal status of cannabis varies significantly across the U.S., with the majority of the states having legalized it for either medical or recreational use, while it remains federally illegal. So it's very weird.
So some of you are probably wondering, well, what's the big deal? Like, why is it illegal in the US?
Yeah, because there's so many medicines and, drugs out there that they're
Yeah.
legal. So
Yeah,
what
exactly.
makes this different?
It's like we're studying LSD for medicine. Like, why?
Yeah,
What's going on with
why is this
cannabis? Yeah.
still like illegal? Yeah.
Yeah.
Go ahead.
So its classification is a Scheduled 1 controlled substance. So under the CSA, or Controlled Substance Act of 1970, cannabis is classified as a Schedule 1 drug, which means that it's determined to have a high potential for abuse and no accepted medical use. This classification prohibits the use of cannabis for any purpose, including medical, at the federal level. So at the federal level.
Yeah.
Okay.
That's why still in the federal level, it's still illegal.
Yeah. So then lack of FDA approval. So since cannabis is classified as a Schedule 1 drug, it has not been approved by the US FDA for any medical use. The FDA has only approved a few drugs that contain the components of cannabis, such as Epidiolex, which contains CBD. So again, guys, we're talking about marijuana in general. We're not talking about CBD, okay, like Epidiolex, okay,
And
or
again,
meds that use CBD and not THC, okay.
And the CBD that is not from marijuana.
Yeah, exactly.
Yeah.
So, and again, like that's a whole entire thing too.
Yeah. Yeah.
So federal government's rights to regulate. So the U.S. Supreme Court has ruled that the federal government has a right to regulate and criminalize cannabis, even in states where it's been legalized for medical or recreational use. So even though you're allowed to use it in that state, if you somehow are caught in possession of something, like they are still able to criminalize it.
They
okay?
could override.
They can override that. Yeah.
The state's
Yeah.
law.
And then conflicting state and federal laws. So while many states have legalized cannabis for medical and recreational use, it remains illegal at the federal level. This creates a conflict between states and federal laws, with the federal government generally not enforcing its prohibition in states that have legalized cannabis. So in summary, the primary reason cannabis is illegal, it's because it's at the federal level, okay, in the United States, and its classification as a Schedule 1 drug. So it prohibits its use for any other purpose, including medical, and due to its federal government determination that it's a high potential for abuse and that it doesn't have any medical use. And again, that's for cannabis in general, not CBD.
Exactly. So since this is like for 420, I was like, where the hell did 420 come from? It's just a random day in April. Like, what the hell? So the term 420 originated in San Rafael, I'll say it in the gringo version, California in 1971. 5 high school students known as Waldos, in quotations, used it as a code for their plan to search for an abandoned cannabis crop. They would meet at 4:20 p.m. by the campus statue of chemist Louis Pasteur. Over time, this phrase evolved into a symbol for cannabis culture, and April 20th, aka 420, became a day of celebration for marijuana enthusiasts worldwide.
Yeah.
Little tidbit there. Because I was like, why? There's so many freaking 365 days in the year. Why 420? And like, what the hell does that have to do with it? So there you go, guys. And other words or slangs for marijuana, because there's so many. These are just a few of them. So ganja, grass, obviously, Mary Jane, reefer, skunk, which is, it's true. Like there is back when we lived in Texas, there was a plant that was like, it was like a weed, and it was like called like skunk weed or something like that. And it smelled just like freaking
gross.
Yeah, it was awful. Anyway, loud. Hadn't heard that one before, but okay. Kush. There's actually restaurants here in Miami called Kush, and they're pretty good burgers. Well, apparently it's a type of marijuana with an earthy, cushy aroma. Okay. Dank. I kind of like that one.
Yeah.
Bud, which is the flower part. Dope. Trees. Yes, I've heard of trees. Yeah. Devil's lettuce, of course.
That's like my favorite, the devil's lettuce.
I know, I've heard of that one. Mario likes that one a lot. Wacky tobacco.
Never heard that one.
Me neither. Electric lettuce.
Sure.
Devil's cabbage.
You got the devil's lettuce, and now you got the devil's cabbage.
Yeah. Icky sticky. So descriptive term for the texture of marijuana.
Okay.
Then you got 40 bag, $40 for, the bag. 20 bag, $20 of marijuana. Couchy, referring to indica dominant strains that are sedating.
Yeah, so indica strains tend to be more sedating, and then the sativa strains are more like uppers.
So chiefing, hogging the marijuana in a group setting.
Blitz. I haven't heard that one in a really long time.
I know.
Just blitz.
And burn one. So just smoking one. So yeah, guys, in summary, just be careful. Happy
Yeah.
420.
Happy 420.
Yeah.
Oh God, be careful.
Yeah,
For the love of
just
God.
be careful.
Yeah, you know what? No happy 420. I don't know.
Coming from the doctor, she's like, no.
Like, I'm not endorsing anything here. Let me make that clear as day. But yes, okay.
All right. Toodles.
Yeah, toodles. Bye. Bye.